The very premature rush back to full normality. And I think we're going to pay a price for that because we're not there at vaccination. The variants are really there, and we haven't protected enough people. And I honestly think that we need to think our way through this, that we're opening up way too quickly for the epidemiologic situation and the risks associated with that.
Let's discuss this some more with Dr. Mohammed Munir, who joins us from Lancaster. He's a virologist at Lancaster University in the UK. Thank you, Doctor, so much for your time. Do you agree with the WHO? Have some countries reopened too soon?
Yes, absolutely. I think if we look onto the picture of number of cases going up and the vaccine coverage going relatively slow, I think certainly we are not at the position where we can open even partially, and many countries have started opening up quite quickly. I mean, here in the UK, as you know, by 19th of July, almost all the restrictions that have been put in place are going to go back. And I think we have witnessed the situation of Israel. Israel has been fully open after 60% coverage of the vaccine, but because of emerging new variants are really going to take that all as successes back onto square zero, because the pandemic is all over in the world and we are all together. We have to curtail it all over the world before any single country can claim the victory.
At what point, though, would you have liked to see a place like the UK start easing restrictions?
I think the critical bit is this vaccine rollout. We have witnessed that there is a strong breakage of the number of cases versus the hospitalization and death in the UK, which is really great news. But that also means that children are not yet vaccinated. And if we fully open, we are going to fuel particularly the new variants. I mean, in the UK, 95% of our cases belonging to the Delta variant. And that Delta variant can ramp into the community quite quickly into people that are vaccinated with one dose or not vaccinated at all, particularly children. And those will be the places where there would be a massive outbreak. So until we reach to a massive vaccination, at least 70% throughout the population, and then we slowly release these restrictions that are put in place and keeping those that are really helping in curtailing the infection, including face masks, including the social distances, that is how we're going to slowly go back into the normality.
Doctor, let's talk a little bit about the Delta variant. We know that it's highly contagious, but how deadly is it, and how likely is it that if you get it, you may end up in hospital?
If we look onto all the variants, those have emerged from the start of this pandemic, I think Delta variant is the most dangerous, more contagious, and people infected with the Delta variant are twice likely to end up in hospital, although the deaths are not really that high, but the severity of the disease is really high. And one of the problem is that the Delta variant is, because of its high transmissibility, is spreading quite quickly within the people those are unvaccinated. So therefore, they are very likely to end up in hospital anyways. And also because the very little quantity of this Delta variant is required to start the infection and to ramp up the transmissibility. All these factors are really bringing this Delta variant as one of the probably the most dangerous virus variant we have seen so far.
Dr. Mohammed Munir, always appreciate talking to you. Thank you so much.